Vasectomy is the most common form of birth control utilized in the United States. Many men who have had a vasectomy find themselves in different life circumstances and would like to expand their family or have more children of their own. For those men, there are two options to expand their family, and one is vasectomy reversal and the other is sperm extraction.
So I was stationed in a military base and they had free vasectomies. So that's kind of how, got the vasectomy done. Didn't really think about it too much. A couple years go by, we really realized that we made a mistake and we really would like to have another child. We decided to go ahead and look into the different options. One was adoption and the other one was reversal. The adoption just seemed very costly, and we did some internet searching and found Dr. Thompson on the internet with some positive results, and had a meeting with him, went through the statistics on what our chances were to have a baby, and then we decided to go with the reversal.
This is a procedure that takes approximately 2.5 to 3 hours to perform, and it's a microsurgical procedure in which we use an operating microscope to perform the delicate connection that we make in this situation. And because it's a microsurgical procedure and it takes that long, it has to be done under general anesthetic. So once the patient has been put to sleep for a vasectomy reversal, we do each side separately. So a man would end up with 2 incisions. I go down to where the vasectomy itself was performed, and this is usually just an area of scar tissue in the vas deferens tube. That area where the vasectomy was performed is actually removed. I then inspect the upstream side of the vas deferens tube, and I actually aspirate the fluid that's coming from this upstream end of the vas deferens. And I inspect that fluid right then and there in the operating room under a separate microscope, and I'm looking for sperm. If we find sperm in that vasal fluid, then I know I can connect the 2 ends that I have there and have good results with a good connection. There is a way to attempt to predict which connection a man will have, and the biggest predictor of whether a man will have a vasovasostomy, the simpler connection, or the bypass connection, the vasoepididymostomy, is the length of time the man's had the vasectomy. The vasovasostomy connection is a much more successful connection because it's less prone to scar tissue forming and blocking the connection off. The vasoepididymostomy connection is a more delicate connection, more prone to scar tissue forming and blocking it off. What a man does after his vasectomy reversal is very important for getting either one of those connections to be successful. So I recommend that men who have had a vasectomy reversal spend at least 7 days at home to recover from the surgery. A man just stays at home, spends most of the time off his feet. He can get up to do necessary things like go to the bathroom or get up to the table to eat. He uses ice to the area for soreness. He also has a prescription for pain medicine that he takes as needed for soreness. After those 7 days, a man could go back to light duty, which would be normal activity. In other words, driving a car, going to an office, being up on his feet. It is really 10 to 14 days before a man is ready to do vigorous activity. So that is heavy lifting, being on his feet all day, resuming any kind of athletic activity, and resuming intercourse. We check the first sample 6 weeks after surgery, and normally results will gradually improve over the first 9 months after a man's had a vasectomy reversal. What a man has in his semen sample 9 months after surgery will normally not change at that point. The actual percent that will conceive and the percent of men that will have return of sperm to the sample depends on the length of time that the man's had the vasectomy. I would say in what we would term a worst case scenario, in other words, a man that's had his vasectomy over 15 years, studies have shown that man with a successful reversal will have a 70% return of sperm. So a 70% chance that man will have return of sperm to the to his ejaculate and about a 30% pregnancy rate. So one important take-home message would be that it's never too late to reverse a vasectomy. It's just that success rate decreases with the length of time that the man's had the vasectomy.
You know, Dr. Thompson and the whole staff just said, listen, you know, I mean, there's a good chance that you will have a baby, there's a chance that you won't. So I just really appreciated the candor and, you know, just the professionalism throughout the whole, even through the surgery. It went really well, the way the staff was, and it was just a really good experience.
Vasectomy reversal is my favorite operation to do. I average approximately 50 to 60 of these vasectomy reversal procedures every year. And I truly enjoy doing this procedure, and I enjoy the privilege it is to treat infertile men and help them expand their families and achieve their goals. At Urology of Indiana, we do specialize in the comprehensive care of infertile men. This includes not only vasectomy reversal, but treating other forms of infertility in men, including hormonal imbalances, varicose veins, and other treatments that enhance a man's fertility.